duration of this meeting. Please use the raise hand feature on the reaction tab at the top of the screen so that we can take your questions. Feel free to post the questions in the chat room and we'll address them accordingly. We will be sharing a recording of this Q&A with those attending this afternoon. Before you ask a question, we ask that you introduce yourselves and your organization you serve. We'll now begin with an update from Dr. Brown. Dr. Brown, go ahead.
Good afternoon, everyone. My name is Dr. Ericka Brown. I'm the local health authority for Harris County Public Health. I will start with a little bit of data with regard to Harris County. As of yesterday, our total count of monkeypox cases was 563. Those within the city of Houston was 455, and 108 of those cases were in Harris County. And we'll open it up for questions. Thank you.
Thank you, Dr. Brown. I'd like to go ahead and open the floor now to any questions from the media. If you can care to place to raise your hands first, and I'll go ahead and address you accordingly. Go ahead, and Adam Bennett. The first question from Adam Bennett.
Yeah. Hey, Dr. Brown. Adam Bennett with KHOU here in Houston. What can you tell us about the a severely immunocompromised adult who had monkeypox and recently passed away? Specifically, can you go into more details about what their condition was that made them immunocompromised? I think maybe that would put a lot of people at ease and also have more people on a little bit higher alert that needed to be.
Sure. Unfortunately, I am unable to give any specific details about the case. Again, as we know, monkeypox can affect those who are immunocompromised. And because of that, we would certainly encourage anyone who fits the current criteria, including the immunocompromised, to seek vaccination.
Next, we have Terrence Fraser. Go ahead and with your question, Terrence.
Hello, good afternoon. Thanks for this. I'm Terrence with American Public Media Group. I'm wondering about the TPOXX medications, like prescriptions, in terms of how many have been prescribed and allocated in Houston. Other municipalities such as New York and LA have publicly available information on this. Is there any information that you can share about the number of TPOXX prescriptions that have been prescribed in Houston?
Sure. I don't have that information readily available, but we can certainly follow up with you after the press conference and provide that information.
Thank you, Julian. Next, if there's anybody else on the floor who wishes to ask a question. Go ahead, Julian.
Sorry, I don't think you got to me on that one, Eddie. But
okay, sorry about that.
It's okay, no problem. This is Julian with the Houston Chronicle. I'm wondering, I know you can't say any more specifics on the monkeypox patient who died recently, but can you say, like, when the person tested positive, whether it, played a role in the hospitalization, like anything beyond what's been shared publicly?
Yes, unfortunately, because of privacy laws and that really protect all of us, I cannot share any additional information about the case. As the autopsy results become available, will certainly follow up as we can again, but specifically about the case, I can't share any details. I will say, though, that for most, monkeypox is self-limiting. It is a little bit more severe, can be a little bit more severe for those who are perhaps immunocompromised, which is why, again, we strongly recommend for those who fit that category of being potentially immunocompromised, those who are HIV positive, those who have certain skin conditions such as eczema or dermatitis, do seek vaccination.
Can I ask a follow-up about vaccinations?
Go ahead.
I just want to ask how many are still available right now, or appointments still being made, and what does capacity look like?
Yes, so I don't have the exact number that are still available. We can get you that information, but we do have capacity and appointments are being made. For anybody who is seeking vaccination, again, our hotline number is 832-927-0707.
Thank you.
Thank you.
Next, we have a question from Patrick, Patrick Wider. If you can introduce yourself and the organization and ask a question, please. Patrick, are you there? Okay, we'll go ahead and handle any questions going forth from here on.
Can you hear me
Anybody
now?
else? Sure. Patrick, is that
Hi,
you?
can you hear me now? Yeah, this is Patrick.
Yes. Okay.
Sorry.
Great. Yes, we do.
Hey,
Thank you.
hey, sorry, this is Patrick Wachter from BuzzFeed News. I know you said you can't share any information about the case right now. You mentioned something about the autopsy. Do you know what kind of information will be available when the autopsy results come out and when that might be? And can you at least tell us the age of the person? Is that something we can learn at least?
Yes, unfortunately, again, I cannot give any specific information about the case. Once we receive the autopsy results, what we're looking to be able to determine is the specific cause of death. We know that this patient had monkeypox as a diagnosis. What we do not know for sure is that the patient passed away from monkeypox.
Thank you, Patrick, for that question, and Dr. Brown for that answer. I guess now we'll return to Terrence Fraser. If you wish to ask a question, Terrence.
Hi, thanks. I just wanted to follow up on the question regarding TPOXX. Was this individual who died, did they receive treatment? And was it effective? Like, was there any, was it helpful in terms of treating this individual? I mean, they died, but was there improvement in the condition, or did it decline, or what happened?
Yeah, so again, I'm really sorry, guys, but I'm not going to get into any specifics of the case.
Next, we have a question from Adam Bennett. Go
Hey,
ahead,
Dr.
Adam.
Brown. Yeah, we've had a couple of cases in schools here in the Houston area, one in Harris County, one in Fort Bend County. Can you talk about what kind of outreach you're doing with schools and with parents and what your message is to them right now to try to minimize the risk?
Sure, absolutely. So we are doing a lot of outreach in the schools, both Houston Health Department and Harris County Public Health within our respective jurisdictions are doing education with the specific school districts, making sure that everyone is aware of the signs and symptoms. We have provided draft letters to parents should they suspect a case. And the key messages are this. One, if you suspect that your child is sick for any reason, please stay home and seek treatment and care. The second piece is that this particular virus for most is self-limiting. So while there is cause for alarm because there's illness, right, we always have concern about our children getting sick. The good news story is that for most, the disease is self-limiting and it will pass. The third thing to know is that good disinfection protocols are important. So good hand washing, making sure, again, that we are mindful to make sure we're disinfecting our common areas, which is difficult in schools, but it's something that we're already used to with COVID. So we really are very confident in working with the schools and the school districts to make sure that we're mitigating as much risk as possible.
Thank you, Dr. Brown. Now we have a couple of questions left. Next, we have Julian, if you go ahead.
Yes, the Harris County Sheriff's Office just basically it said last week, I believe, that there was a monkeypox case in the jail. What is Harris County Public Health doing with the Sheriff's Office to ensure that that doesn't spread?
Yeah, so again, I think it was stated when the case came out that Harris County Sheriff's Office has done a phenomenal job in managing COVID and now monkeypox within a congregate setting. Similar to what we're doing with schools, education, and making sure that there is a disinfection program in place, which again, there already is because of what we've all gone through with the COVID pandemic, continuing to assist with contact tracing, as well as providing vaccination as necessary. These are all the ways that we're supporting.
Thank you, Dr. Brown. And now we have one more question left before we wrap this up. Go ahead, Adam. This is the last question.
Yeah, just a follow-up question from one of my managers, just to confirm this case involving the death with monkeypox. Just confirming this was a diagnosis of monkeypox and not a presumptive positive, correct?
So thank you for that question. All diagnoses of monkeypox are initially presumptive positive diagnoses. Then a select case, a select number of the cases go to the CDC for confirmation.
So, okay, so where do things stand right now? Has the CDC confirmed it at this point?
The CDC is working with us to work through this case.
Thanks again, Adam, for your question. And thank you again, everybody, for joining us. And thank you, Dr. Brown, for go ahead and visiting with our media partners this afternoon. Wanted to just let you all know that we'll share the recording of this to our media partners who are attending today's updates. So we'll share more information on the road ahead forthcoming. But we encourage everybody also to please continue to share our information in terms of the efforts that we're doing here at Harris County Public Health, especially with our local media. Our hotline number at Harris County Public Health is 832-927-0707. And our monkeypox, and for more information, people can visit our monkeypox guidance page at readyharris.org. Thank you all so much for joining us, and until next time, thank you.